March is Liver Health Month. 1 in 4 Canadians are living with liver disease, according to Liver Canada. The liver filters blood, helps digestion, and removes toxins from your body. You can't live without it. There are things you can do to improve or prevent liver disease. Joining us now is Dr. David Peretz with the Manitoba Liver Transplant Program. Good morning, doctor.
Good morning.
Thanks for joining us. Now, tell us about the liver. Why is it so important? What does it do?
Well, first of all, the liver is a unique organ. It's the only organ in the body that has the capacity to regenerate and has anti-fibrotic properties where scar tissue can actually melt away. Liver does so many things that we still today have not been able to replicate all of the things it does. As far as having a machine or a dialysis machine for the liver. So we're learning a lot about the liver, but we're still have a lot of ways to go to replicate what it does.
What causes liver disease?
So there's a whole bunch of things that can cause liver disease. Some of it is environmental, some of it is genetic. A lot of the things that can predispose to liver disease include our lifestyle. So, fatty liver is one. Of course, we think of alcohol, and there's other things as well.
And fatty liver disease is also very common. So what causes that to happen?
So again, there is a genetic component. So there are people who really don't do anything in particular, but there's things that we can control. The things we eat, of course, the lifestyle we lead, being physically active, proper food choices.
Okay, so what can we do to prevent liver disease? What's the best way? What's the best course of action? So we recommend healthy eating habits, things that we already should be doing. So, fatty liver, for example, is very common, and it is treated with just eating healthy, keeping a healthy body weight. Mediterranean diet, fruits and vegetables, that's one diet, but it's not the only diet. I would say being very cautious with alcohol. We used to tell people you can have alcohol in moderation, but we have to be very careful with that. And especially if you already have risk factors for liver disease, I would say avoidance of alcohol. Coffee is good for the liver. Interestingly, we recommend 2 to 3 cups per day. And it's not just black coffee. It seems to be any type of coffee. So, the espressos, the lattes, the decaf, anything. There's antioxidants in coffee, which have benefit to the liver. Okay, but unfortunately, many people get to the point where a liver transplant is the only way for someone to live. What do you want people to know about that and the Manitoba Liver Transplant Program?
Well, again, this is the liver works until it stops working, and then it becomes a very serious situation. There is a shortage of organ donors, as we all know. Being organ donors is one way to contribute, and just increase awareness. Prevention is the key. So if you have modifiable risk factors that you can adjust, that would be the best thing you can do. But again, if someone needs a liver, then it becomes quite serious, and we're always very quick to get people if they need to be on the transplant list.
Thank you, doctor, for your time today. We appreciate this information.